Hi and welcome. We are so glad to have each of you here with us today. Thank you for joining the second session of CF 201, Embracing the Mission. My name is Sarah Nelson, and I will be moderating today's session. So my connection to cystic fibrosis is through my husband, Paul, whose brother, Matt Trotter, passed away from CF in 2007. While the Nelson family has been involved with the Cystic Fibrosis Foundation for decades, I have been actively involved with my Kentucky, West Virginia chapter since 2017 and participate annually in our various Louisville, Kentucky events, including Great Strides, the CF Climb, and our chapter's annual 65 Roses Gala. In 2019, I was also nominated for the Derby City's Finest program and was the top fundraiser for my honoree class. Fun fact, I actually nominated my sister, Katie Ashley, for the Finest program this year, and she blew past my total, raising more than $10,000 for the foundation. And we were actually able to honor her at the 65 Roses Gala just this past Friday. So I'm very proud of her. Today's session is titled Mental Health in the CF World. We have a wonderful lineup of speakers today who all have different stories regarding mental health, specifically with CF. Unfortunately, one of our panelists, Noelle, wasn't able to join us today, but we wanted to recognize her and her contributions as we prepared for today's discussion. So before we get started, let's go over a few housekeeping details. Please remember to select all panelists and attendees in the drop-down menu when submitting your comments. We will also have Q&A at the end, so please feel free to submit your questions in the Q&A box throughout the session. Now, please help me welcome our first speaker, Dr. Zach Held, who is a licensed clinical psychologist at Levine Children's Hospital in Charlotte, North Carolina. He specializes in pediatric psychology with chronically ill children and adolescents with a clinical focus on working with the pediatric cystic fibrosis populations. His area of expertise includes pediatric anxiety, depression, medical trauma, and treatment adherence. He is also the director of the Psychology Practicum training and a member of the Pediatric Science Research Review Committee at Levine Children's Hospital. Please join me in welcoming Dr. Held.
Well, thank you very much for that introduction. And thanks for having me today. I think I just want to add real quick and spend a minute or two talking about my involvement with the CF population, how I got started. I actually did my fellowship with pediatric hematology and oncology. And after a year of working with that population, I really wanted to work more with a chronic illness population. And I was able to join a really great pulmonology and CF team here at Levine Children's. I think what's interesting about my career working with CF and something that I like to talk about whenever I give talks to the CF community, so that you know kind of the lens I'm coming from, is when I started working with the CF population, it was basically right when Trikafta was announced. I think I started working in the clinic maybe like a month before the big NACFC announcement at the conference. And that's really been an amazing opportunity for me to see all the changes that Trikafta's made for patients and the impact that it's made. But I think when you combine that with the fact that I've also been a part of working with patients through COVID, I feel like there's been two once in a lifetime events in the CF population in just the 3 or 4 years I've been working with them. So I always like to give that little disclaimer. That's kind of the lens that I am doing my work with CF patients from and their families. And I think it's been a really exciting time to be part of their journey. So given that background and lens, I like to start all my presentations that I give with a quote from Dr. Ross Green, and he said that I like to think of children doing as well as they can instead of doing as well as they want to. And I think this is a really important lens to look at the work of psychology and social work and working in a medical setting with kids who have chronic illness, because I like to think about this quote and take it in context. And what this context allows me to do is try and understand a child from a perspective of both what is getting in the way of their success and what skills they are potentially lacking that we can help them achieve and do better with so that they can succeed in the ways that we need them to succeed. So if I can do that, and if we can do that as a team, then we can extrapolate that to what we can do to help children and parents learn these skills and create an environment that will allow them to do as well as we need them to do through a really high treatment burden and throughout their entire lives. So what I primarily want to talk about today is depression and anxiety, and specifically why it is more prevalent in CF and chronic illness. And then I want to talk about some skills that we can use to help support our patient population who experiences depression and anxiety. So in terms of depression, it is more prevalent in chronic illness and CF for a number of reasons. They include social isolation, medication side effects, and just the general stress of the illness. But what I really want to focus on specifically for our CF population is the burden of care and the school and work problems that happen because of this depression that comes with chronic illness. So first, in terms of burden of care, as we know, there's a huge burden of care in CF. But if we think about it from a developmental perspective, our CF patients, as they get older and become teenagers, what do we know that teenagers always do? They rebel against their parents. And what is the most consistent thing that our CF kids have been told to do since they were little kids is to do their treatment and take their medication. So in addition to the burden of care, when CF kids kind of move into early adulthood, teenage years, we see a lot of normal teenage rebellion. But for our CF kids, it's often in the context of treatment non-adherence, because this is something that their parents have been telling them to do for their entire lives, and they're trying to figure out why they want to do it, as opposed to just having their parents tell them to do it. So we see this correlational relationship between treatment burden, depression, and CF. Second, when we talk about school and work problems, we need to think about what we are asking our patients to do when they come visit us for clinic, when they come into the hospital, and all the effort that it takes for them. So when we think about clinic or extended hospital stays, if we think about that from a developmental perspective, again, if we're looking at teenagers, we're taking them away from school and their peers, who in a lot of instances are passing them both kind of physically, academically, and just in general life experiences. And this is right around a time when developmentally peers become more important to these teenagers. So we're really asking a lot of them, and we're asking for a lot of sacrifices when it comes to this. And then for younger kids, we have to think about how they interpret their world. So because they're not independent, their world consists primarily of school and home, right? They go back and forth day in, day out from school and home. But with CF, we're adding another setting for them to navigate in the form of clinic visits, hospital stays, and this setting comes at the expense of one of the other two settings that their peers are having experiences in. This can cause significant fear of missing out in younger kids because they're feeling like they're not connected to their peers. And they can also miss important milestones and experiences, which in younger kids are really important, because in younger kids, friendships are typically based on shared experiences more than the emotional connections that older kids tend to make with their peers. So if they're missing those shared experiences, they can miss out on making friends. This also causes depression, obviously, if they're having trouble making friends. And in younger kids, we can often see that take the form of behavioral problems. So that kind of covers depression. If we move on to anxiety, there are many reasons why anxiety is more prevalent in chronic illness in CF populations. Things like pill swallowing anxiety, needle anxiety, anxiety around frequent hospital stays or chronic pain. These are all related and relevant to the CF population, but the main aspects that I think are important to anxiety in the CF population are illness uncertainty and medical trauma. So these are very important concepts. They have very subtle differences. So illness uncertainty is the idea that every time our kids come to clinic or an appointment, they don't know what to expect. What I mean by that is they don't know if their PFT levels are going to be good. They don't know if they need to be admitted to the hospital. Are they going to have a low weight and need an NG tube or some sort of intervention there? There's a lot of uncertainty in outcomes, and these outcomes can have a significant impact on them. It could be the difference between going home in 3 hours after a clinic visit or staying in the hospital and missing all your schoolwork and social activities for the next 2 weeks. So as you can imagine, there's a lot of pressure, and that can breed a lot of anxiety. Conversely, medical trauma is the idea that every experience that are negative, such as a traumatic blood draw or difficult admission at a hospital, can activate a trauma response in our patients, and they'll respond in a way that mimics PTSD. So for example, when they get near a clinic, they may have an anxiety response or panic, or there may be a specific room where they had a procedure or where they got some bad news or a smell that reminds them of something that can activate a trauma response. And this response can look a lot like anxiety and panic. Where it's hard is that most trauma responses for these patients oftentimes are disproportionate to the situation, right? If you put them in a room where they maybe had a bad experience and everything's going well, and they have a panic attack, it may not make sense. But how we respond to that panic or anxiety or depression can make a big difference on its severity and progression. So if we tie it all together, and take it all as a whole, how does this impact treatment outcomes? There are a number of ways that include increased risk of hospitalizations, withdrawal from treatment, poor family functioning, but I want to focus on an aspect that I think encompasses a lot of the ways that depression and anxiety impact treatment outcomes, and it's the idea of decreased quality of life. So I think whenever we're talking about treatment outcomes, it's helpful to look at it from our patient's perspective. And if we do this, it would make sense that if a patient's depressed or anxious, they're going to feel unmotivated or have trouble engaging. And this lack of motivation can lead to decreased treatment compliance, increased risk of hospitalizations, but in general, it again leads to an overall decrease in quality of life. And I think this is really the most insidious part of anxiety and depression in our population, is that this lack of motivation and depression, whereas kids who don't have CF and maybe don't have chronic illness can take the form of not doing their homework or being late to school or any of that stuff. But for our kids, it leads to treatment non-adherence, which can have significant consequences and can significantly impact their quality of life. So, given all that doom and gloom, what can we do to help our patients? Well, one of my favorite tips and interventions that I use is this idea of mindful relaxation. So this is basically the opposite of automatic pilot mode. This typically will work primarily for older kids and teenagers, but mindfulness is the awareness that emerges through paying attention purposefully and non-judgmentally, and you're paying attention to the unfolding experiences moment to moment, including thoughts, feelings, and bodily sensations. A shorter, more concise version of that would be basically just paying attention to the present moment in a non-judgmental way. So an example I always like to use is this idea of visualizing your thoughts as a leaf on a stream. So if you find a really comforting place, you're on the shoreline of a really relaxing stream, and you envision each thought you're having as just a leaf that's floating down the stream, we have a couple of options. We can run into the stream and grab the leaf and really examine it and take it home with us and focus on it. Or we can just notice that this thought/leaf is happening and let it kind of float down the stream. We can label it for what it is. It's just a thought. It doesn't have any impact on the outcome of anything, and kind of notice it, give yourself credit for noticing it, and then let it go. So we're kind of not taking that next step and judging ourselves for that thought. So really what this idea of present moment awareness and non-judgment does is it keeps us from taking that next step, like I said, but that next step is typically, what does this mean about me? So for example, I'm having a tough time getting out of bed this morning. I don't want to take the next step and say, this means that I'm lazy, right? I just want to stick to the facts of the situation, which is I'm having a tough time getting out of bed. I'm not interpreting or judging myself for that. So I think this is a really powerful tool, the mindfulness present moment aspect to avoid worry, but also the non-judgmental aspect to avoid depression and not taking that next step into saying, this means this about me. So along that vein, I also want to talk about what you can and can't control. And this is really important with chronic illness, but CF in particular, because there's so much that you can't control. So the temptation that when we can't control things is we want to make contingencies for every possible outcome. Well, if this happens, I'm going to do this. And if this happens, I'm going to do that. When in reality, all you can control is your own actions and then your reactions to what happens. So this is the difference between can and can't, and it can be subtle. So for example, I can control who I put on my schedule for therapy, when I see them, how many people I see in a day, but I can't control who shows up. So I would want to avoid making plans for what I'll do if I have 3 no-shows in a row because I can't control that. So instead of planning for every possible outcome, I would just tell myself that I trust myself that I can handle whatever happens and I will handle it in the present moment. Again, we're going back to this present moment idea. I'll make the best choices I can with the information I have at the time, and I can trust myself to handle whatever happens and reactions I have. So this can lead to avoiding worry and anxiety because you don't have to worry about all the possible scenarios that are possible and what will happen because you trust yourself to deal with what comes up when it comes up. So finally, the last thing I want to talk about is, and this is maybe my favorite thing, is just the immense power of giving yourself compassion and the importance of the language that we use in describing our circumstances. So the best definition of self-compassion that I've been able to come up with that seems to really resonate with the kids I work with is the ability to give yourself the same compassion and grace as you would give your best friend or someone you really care about if they came to you and asked for help with the same circumstances that you are going through. And to this end, I often ask kids that I work with, what's the advice you would give your friend if they came to you with this issue? And then depending on what they say, and they typically say something very insightful, it becomes an examination of why we can't give ourselves the same grace that we give our friends. I think also another really powerful exercise that kind of goes along with this is acknowledging that seemingly disparate things can be true at the same time. So, and this is really the power of language. So for example, there's a big difference in saying, I worked really hard this week, but I didn't finish my homework. And I worked really hard this week and I didn't finish my homework. So in the first example, when you say but, it negates all the hard work. It says, but I didn't finish my work. So it wasn't good enough. In the second phrase, you're saying both are true. I worked really hard and I still didn't get it done. But that doesn't mean that you didn't work really hard. So you're acknowledging that two things can be true and you're not punishing yourself or putting it in a negative light by saying but. So the language that we use, as well as the compassion that we give ourselves, can make a huge difference on how we perceive the world and how we perceive our accomplishments. And just these kind of small changes and exercises can really help with the anxiety and depression that a lot of kids with chronic illness and CF go through because of the burden that we put on them with treatment. So I hope that was informative. Thank you again for inviting me to talk. That's all the time I have, but thank you very much, and I'll send it back to Sarah.
Wonderful. Thank you so much, Dr. Held, for sharing your story with us and all of those great resources and recommendations. We really appreciate it. Next, I would like to pass it over to our final speaker, Stephanie Fort. Stephanie is a licensed clinical social worker in Anchorage, Alaska. She has been a medical social worker for almost 15 years and is currently the social worker and mental health coordinator for Providence, Alaska's CF Care Center. She has worked at the Care Center for 5 years, and she also serves as a mental health clinician for children, adolescents, and young adults with chronic medical conditions. In her free time, Stephanie enjoys hiking, skiing, and fishing with her family. So please help me in welcoming Stephanie.
Hi, thanks so much everyone for welcoming me today. I'm really happy to be here. So going back to my CF history, I actually started out my career on the East Coast, and I was working at a hospital there just on the inpatient floor as a social worker. And I ended up starting to care for out in the community childcare because the pay for an MSW at that time was not very good, and the girl that I was caring for had cystic fibrosis, and so through that relationship, I started understanding kind of from a family perspective what that day-to-day life entailed and everything that went into it, and also the strain and the stress on the family. So that when I came to Alaska and I started working here, eventually the position with the CF clinic came available, and I took it and started working here and kind of worked for a few years and then left for a few years to work in oncology and then came back. We're a multi-age clinic, and so it's, lifespan clinic. So we go from birth to adulthood. So I get to work with babies all the way up to some patients in their 70s, which is pretty amazing because back when I started my career, that would have been unheard of. What I have noticed over time is that the importance of a relationship. And that's really what stemmed me from going from just sole social worker mode into this mental health clinician piece that I have. And my clinic is small enough that it's allowed me to kind of develop the position as we as a team felt was needed, both within the CF clinic and all of the other subspecialties and chronic illness populations that I work with, which include diabetes, pulmonology, neurology, GI illnesses, to name a few. And so what we found is oftentimes kids with chronic illness don't want to tell their story again. And even, same with adults, you know, you get very tired and drained from having to repeat yourself. And so having that relationship with someone who understands and who has kind of walked along you through that path can be really powerful, as long as it's a healthy relationship, and really recognizing what does a person need and is it a good fit, and what does that look like? And so what I have found really with all of the chronic illness populations, including CF that I provide therapy for, is that really stepping away and letting the client choose what's important to them. Where do they feel they're struggling? Where do they feel the need for support? Sometimes it is regarding the chronic illness. It's the disease burden. It's having to come to clinic all the time. It's having to take the medication. But then other times it's, you know, how do you engage and interact with your friends? What's going on with your relationship with your parents? Is there a separation going on in the household? Is there a move? And providing a space for that to be reflected and moved through and processed. And so some things that we have found, that I've found has worked really well, is breaking things down. You know, sleep, super important for mental health. I think a lot of times we forget that, where we all live very busy lifestyles. And so being able to take the time to kind of be like, oh, am I sleeping? What does my sleep hygiene look like? What is my nightly routine? So usually having a nightly routine that you step through, that you consistently do, brushing your teeth, settling down, maybe turning off the TV or other electronics. That's really important to allow yourself to then slumber and move into that process. And then having a similar wake schedule the next day can be really helpful, especially when one's experiencing symptoms of depression, anxiety. I think too, diet, what we eat, can also heavily influence it. And in addition to that, looking at Trikafta and how that's been associated with this weight gain, really looking at what's one's relationship with food? How do they work through that? How do they feel? A lot of times thinking about, if you're feeling really down, well, why is that? And really reflecting on it. A lot of anxiety or body dysmorphia has been happening with Trikafta, because for so long, clinic providers have been telling the CF population to eat, eat, eat. You can eat whatever you want, high fat foods. And then all of a sudden, it's this opposite being told. And so really, especially the adult population, that's become a huge struggle. Another, Zach already talked about mindfulness. I agree, super important, being able to really take into why one feels one way, what is happening. If an event occurs, wow, what's my body telling me? A lot of times when we look at clinic visits for a lot of chronic illnesses, not just CF, you look at diabetes, type 1 diabetes, they come in every 3 months as well and have a daily medicine regime that they have to do that they never get a relief of. And really reflecting on, okay, you're coming to the clinic visit. Wow, my body feels more agitated or tight. why am I feeling that way? Oh, did I have a negative impact on or a negative experience in the past at the clinic? And being able to, one, acknowledge that feeling and really think about why that happened, and what interaction may have caused that feeling. Sometimes we can't identify what it is, and it's just can be the burden of just coming and that unknown. But sometimes it could be, okay, I didn't have a good interaction with a certain provider and I'm worried that's going to happen again. Or sometimes, a lot of times I have some young adults, teenagers especially, who they just hate coming and they feel they're going to get yelled at every single time they come. And I really try to emphasize to all of them and to the medical providers I work with that, it's not our job to yell or to make someone feel bad. It's our job to acknowledge that it's really hard, and how do we help you do your treatment regimes? How do we help you get that motivation to increase? Where's the barrier? And a lot of times it's as simple as breaking it down by going to one thing. So a lot of times, for instance, okay, you're supposed to be doing breathing treatments twice a day, every single day, 7 days a week. Well, if you're not doing it at all, that's really overwhelming. And in a lot of ways, you might say, okay, I'm at clinic visit. I'm going to do this. I'm on it. I'm going to be so successful. Next time I come in, they're going to be like, wow. And you get home and it's really hard. Life happens, and you miss one. Well, then you may start feeling down. Okay, I'm going to try. And if you miss another, well, you're feeling down again. And so instead, finding that motivation of saying, I'm going to increase by one. And you start doing it maybe once a day for 2 days a week. And then you get successful and you're feeling good about it and you're able to do it. And once you have that routine going, increase it by one. This can be the same with diabetes as well. A lot of times before continuous glucose monitors, so it's a blood sugar monitor that's attached to your arm. Well, before that, people were doing finger sticks and they had to do it at least 4 times a day. Well, if you're not doing it at all, and then you have to go up to 4, that can be so intimidating. So instead saying like, okay, I'm not doing it at all. I'm going to go up by 1 every single day. You get that into the routine, into the pattern, and then you increase it by 2. And so what you're doing is you're developing positive habits that you're feeling successful about and feeling really good about. So the last kind of key piece too, I think that's really important that I often talk more with the teenagers and young adults and adult populations I work with is looking at devices, screen time, social media. In the CF world, it's been amazing. It's a place to connect with others, but it also can be a place where we can feel overwhelmed. A lot of times, we can't monitor, we can't distinguish like the really positive stories versus the really hard stories. And so really being able to reflect, okay, if I'm going to be looking on social media for people who have CF, how do I feel when I look at that? What is it providing me? What kind of relationship? Is it providing a positive emotion? Is it providing me stress because of the what if, and I then worry about my own health? And so really kind of contemplating on that, but also acknowledging our in-person relationships. The more and more use of technology, especially teenagers too, and young adults, that in-person, face-to-face interactions and relationships have become less and less. The interesting thing I found in the populations that I work with is the vast majority of teenagers that I work with have told me that one of their biggest regrets is actually getting a cell phone and going on social media, because it becomes this sole focus of how they view themselves and constant feedback and it consumes time, and having those skills to be able to have interactions and conversations, and how to make a friend as well, and healthy friendships, is really difficult now. And COVID has only made that more difficult due to isolation factors, from being away. And so what I've noticed is, you take the chronic illness, and we'll put that to aside because, we're talking about that, but also just on a typical normal day-to-day life, people really struggle now with being back in the community, being back in larger settings, being back in school, interacting with others, adjusting to what life looks like and all the different emotions that are coming out. Like, people have very strong feelings. And so being able to be very mindful about how one's feeling and about how you're going through that, and what you need, and being able to say, like, who can I reach out to, and identifying those people that are there for you and are able to walk that journey with you, or to just be able to listen and provide you that positivity of, yes, you're feeling this way, but I'm here for you. And I think that that's one of the really important things, is that finding that sense of um, acceptance, that, what, all feelings are justified. You don't have to have a reason for why you're feeling that way when you're explaining it to someone, a family member or friend, but being able to say, I feel this way, and then acknowledging that. And I think family members and friends of a person with a chronic illness, or just a person in general, saying, yep, I understand that. Like, that stinks that you're feeling that way. What can I do? Can I just hang out with you? And finding those simple things that maybe could provide a distraction. The other last key point that I like to use and talk a lot about is positive self-talk. A lot of times, in general, we as humans, in society, we can feel really negative and hard on ourselves and whatnot. So instead, reframing it and saying, okay, this is what I was able to do. This is a key point that I did. I am proud of myself. I think being able to say that and saying, I did a good job. A lot of times, the teenagers and young adults I work with, they laugh at me and roll their eyes, but we do it together because it's something that it's not a norm. And so making it more norm, and being able to identify what you're doing well instead of where you could do better, is super important. So the last bit of my talk, and then I think I'm almost out of time, is I just wanted to talk about how to find a therapist. With COVID, we always talk about the negatives of COVID, but the one I think really positive thing about COVID is that mental health has become more of a norm, and it's more spoken about. In the past, it was a stigma that people kind of shunned away from. And now it's like, hey, this is real, this is going on. And so finding a therapist, I always say, see who you connect with. There is, not every therapist is right for every client. I always say that to my clients, if there's something that really annoys you, or if you don't feel this is a good fit, tell me, let's talk about it. Let's talk about what you feel you need. And you know what? Search the bios. There's great resources out there to be able to come up with a therapist in your area. Psychology Today actually has a listing where they have profiles out there, and people list who they see, where their specialties are, kind of what their comfort levels are, what treatment modalities they do. I always say, do your research, look it up, pick a few that maybe might be a good fit, and take your insurance, and then have a conversation. It's your right to interview them. If you do feel that if the clinician at your CF care center or other center, if you have a different chronic illness, is a good fit, great, that's wonderful. But if you also feel that you need someone that you can say, like, I hate my care team, or I'm so annoyed with my care team, or I don't want my care team knowing everything about me. That's okay as well. I think that the right to be able to have privacy and know what you're comfortable with is really quite important. Um, I think that that's all today. So I'm going to pass this back to Sarah, but thank you so much for having me.
Wonderful. Thank you, Stephanie, so much. And thank you, Dr. Held, for sharing your experiences around mental health and how CF affects mental wellness. I was over here taking so many notes and just wanted to share, some of the things that really stood out to me as someone who is a family member who has lost a loved one to cystic fibrosis. And also, being able to be that present, positive support for my friends and others I meet who are CF fighters and who are navigating this world we're living in. Zach, some of the things that stood out to me the most was really just that connection between treatment burden, depression, and cystic fibrosis, and putting into perspective the simple things that we may take for granted, like managing school and work or everyday anxieties, and how that's really amplified for those living with cystic fibrosis or a chronic illness, and how that lack of motivation or engagement can really lead to treatment non-adherence. I loved the resources you provided, the mindful relaxation, that I'm going to take that envisioning a leaf floating down the stream exercise, because I know that some stress management is a thing that I am trying to work on personally. Being mindful of giving yourself compassion and the importance of using, positive language. And Stephanie, you kind of touched on that as well, positive self-talk, and mindfulness. And I loved that you also focused on other, just again, typical habits that we may take for granted and overlook, like the importance of our diet and sleep. So thank you both so much for talking through this. I think the biggest takeaways I have are that small changes and actions can make the biggest impact, that there is true power in the importance of building healthy relationships with your care team, families, and friends, like identifying and championing and leaning into your support network, and embracing your authenticity, giving yourself grace. It is okay to ask for help. It is okay to not feel okay. And if we take the time to develop those positive, consistent, healthy habits, and and acknowledge those and speak those to hold ourselves accountable, but also to make sure that your support network is ready and understands how to help you, will just make all the difference. So truly inspiring. Thank you both so much for sharing your wisdom and guidance with us today. And with that, we do have a few minutes for Q&A. So we're going to open up this time now for Q&A. As a reminder, please submit your questions in the Q&A box. And I'm going to kick us off for a question for either Zach or Stephanie. Do you notice higher levels of mental health issues in caregivers? So Stephanie, you had mentioned, our role as medical providers, and I think this can, impact caregivers, is to acknowledge that it can be really hard and to be able to be present and willing to help. So have you seen higher levels of mental health issues from a caregiver perspective? And if so, what can they do to help combat some of that mental fatigue?
Yeah, so this is actually something the CF Foundation came out with several years ago, is when they started implementing the depression anxiety screenings, is they recommended for caregivers as well, because it was known that, that medical burden, that caregiver burden is pretty intense on parents, especially, the fear of what that their child's life will be like. And I think being able to grieve the loss of, in quote, a healthy child, because that can be really hard. So yeah, I think it's out there, but I also think that finding the appropriate time to have that conversation is also really important. Parents and caregivers don't want to talk in front of their kids. They don't want their kids to know everything about them. And so being able to, find the right time, whether it's a phone call, whether it's a video visit elsewhere when their child is not present, or even having them come out of the room and having that discussion of how are you really doing, and what can we do to help you, and what symptoms are you having, what's your sleep like, what's your food like, your diet, and it has really opened up that conversation and that acceptance of how difficult it is. And I would say there, in our patient population, there is a pretty significant mental health struggle and coping struggle.
Thank you, Stephanie. That's super helpful to hear that it's present, but then also again providing and reinforcing that advice and those tips and resources I think are really beneficial. So another question, either of you, we talked about Trikafta. You both mentioned Trikafta a little bit in your presentations. So have you noticed a shift in mental health in patients specifically that have started on Trikafta? Anything unexpected or anything new, or anything that, from a treatment and habit perspective, some of the advice you gave can relate to?
I think one of the things that is unexpected for me is for my teenagers in particular, there's this idea of I wasn't really making long-term plans. I didn't want to go to college. I didn't want to do any of that stuff. And now I'm rethinking that, and kind of rethinking these long-term plans of, I can do a career where, I'm doing, manual labor or whatever it may be that maybe I wouldn't be able to do before. I think has been a difficult shift for some of my older kids to make. I think the younger kids have done a little bit of a better job with it. But, I think it can go the other way where a lot of people are like, oh, I'll be fine as long as I just do my Trikafta. And, in some cases that may be true, talking to your pulmonologist, but, it's not a cure-all for everyone. So I think kind of the more information we get as Trikafta is more common in treatment over the next couple of years will be really important, especially as it relates to mental health, because we're still not entirely sure about the side effects in terms of mental health side effects from Trikafta. So.
I think the other key piece too with Trikafta in the mental health conversation is for those who don't qualify for Trikafta and how that feels, and acknowledging that, and acknowledging feelings of almost feeling left behind, even though the CF Foundation, they're looking for a cure for everyone, but Trikafta has taken over the conversation, really. I think the other piece too is for when someone is on Trikafta and then they have to come off of it for medical reasons. How does that feel? What is the mental health impact, the anxiety, the stress associated with that? Or if they're taken off and put back on, and then that fear of being taken off again. And I think the other really key piece is really the weight gain and the change in diets, and how a lot of the adult population especially views their body, and the weight gain, and going from someone who's being told the majority of their lives, being acknowledged for how, in quote, skinny they are because society focuses on that, to then gaining weight and having this unhealthy relationship with food, or having body dysmorphia.
Yeah, that's huge, especially when I feel like you're in that adolescent phase and you're growing into adulthood, and that's such a sensitive time to kind of embrace and love yourself when you're wanting to compare yourself to so many other people. And that mind shift of, oh, now I need to completely rethink the way I eat and I manage my health, is huge and can be hard for that age range. And I do remember when I did the Finest program, I met someone with cystic fibrosis who was my age, and just her day to day. And she's like, yeah, now I guess I need to get a 401k and save for retirement. I never expected to do that. And I was like, oh, that's just like that's just was ingrained in me, that's just part of life. So it's true. Like, you don't think about those small things that make a huge impact. So that's really insightful. Thank you. We do have another question. This is for you, Zach, specifically. So an attendee shared, I have always had a very mild experience with CF. I was diagnosed at 3 days old, but have only been admitted to a hospital stay once 6 years ago and have always kept around high 80, low 90% PFTs. I'm now 26 and have struggled a lot, especially as an adult with imposter syndrome, feeling that I'm too sick to be normal, but not sick enough to feel I belong with the CF community. So that kind of feeling like they're balancing. It's made it be a difficult experience to keep a routine of treatments. So the question is, have you talked with patients who have experienced something similar, kind of being in that gray area? And would you have any advice for them?
That's really an interesting perspective. I think maybe not someone who has experienced something or expressed something somewhat similar to that. I have had a couple patients who I've worked with who have talked about, kind of their gastro and GI problems, and how, if there's like an ethnic component of not being able to eat food that's important to their culture, they feel like they don't really fit in and they don't really fit into their culture. So I think that's the thing that I would say is probably the closest I'd experienced. And what I would say to that is, if you think about kind of CF and normal on a continuum, sometimes you fall to one side, sometimes you fall to another side, sometimes you're right in the middle, but that doesn't mean you're off of the continuum. And I think that we get into trouble sometimes when we try and think about like what is normal and what is not normal. And an exercise I like to do sometimes is, if I were to introduce myself to someone who doesn't know me, what would I tell them that's important about me? If I could tell them 3 things, and if that's not CF, that's fine. And if one day, you're feeling a lot of symptoms or whatever it is, and that's CF that day, that's fine too. It doesn't have to be one thing that defines you. So I think looking at it on a continuum and through that lens can be helpful.
That's wonderful. Thank you. I like that idea of it is a part of who you are, but not necessarily your sole definition. It's a collective part of all the things that make you great. So thank you for that. This next question is for Stephanie. Prior to the pandemic, socializing seemed so easy. You kind of touched on this a little bit. Now I feel like my social battery drains me a lot sooner these days because of interactions and how different they are and getting back into in person. Any additional advice on good best practices of how to navigate those kind of new normal life patterns?
Yeah, absolutely. I think the biggest is acknowledging how you're feeling and giving yourself grace. You know what? COVID has brought so many negatives, but at the same time, it's provided us time to reevaluate our lives and what's important and what relationships are important for us. And so as you begin to navigate more socialization, really thinking about like, what do you want? Who do you want to spend time with? What does that look like? Do you need time to be able to rejuvenate? Does going to work all day and interacting in person in the office, is it to the point where you just need to go home and rest, or go home and go for a walk and have some time to yourself? That's okay. Giving yourself permission to say that's okay is really good, and it's good for self-care. I think also acknowledging what does it look like when you're feeling exhausted or overwhelmed, what type of situations, and easing your way back in. So instead of saying, okay, I'm going to go out this weekend and I'm going to go to a club and dance or a bar, okay, it's going to be a big deal. How about I go and get a coffee with some friends and we sit outside, and then kind of slowly adding on to that if that is something that that you want to do and that you're interested in. One really interesting fact I found from some of my adult COVID patients that I've talked to is about this feeling of isolation and how they feel COVID has impacted them. And quite a few, and granted, Alaska is definitely a different demographic than the majority of the country. It's very spread out, very remote communities. But a lot of patients have actually said that wearing a mask, I already wear a mask, is what they say to me, or having to isolate. Well, we already have to isolate a fair amount. And so several of them, numerous of them, feel that the impact of the COVID in terms of isolation hasn't been as big of an impact as it is, say, for the general population. But I also want to make sure everyone knows that, like, we are not the norm, and just because some are saying this does not discount the feelings of others.
I think that's really, really an important point to drive home, is that your feelings are valid. They may be unique, they may be similar, but at the end of the day, they are still valid to your unique experience. Definitely. All right, so we do have time for one more question. Either Zach, Stephanie, feel free to weigh in. When it comes to mental health, do you run into any compliance issues, or what are the most common compliance issues that you may see when dealing with mental health?
So I guess for me, I don't know if it's necessarily a compliance issue, but I think one of the biggest issues that I see is just the lack of knowledge about what therapy is and what mental health services are. I've had kids come in and say, if they tell me something, I'm going to send them to an inpatient unit. I've had kids, not know what anxiety is or depression is, and that's totally fine. But I think starting conversations with kids from a young age, just from the perspective of normalizing these feelings, is really important. And I think as educators and clinicians and parents, we can really kind of drive that home for them of, yeah, like anxiety is totally normal. I don't want to do my treatment. Yeah, I can understand that treatment is hard, treatment stinks. And, we can validate emotions without validating a negative behavior. And I think that's a really important distinction to make. Like, we can validate someone's angry, but not encourage them to throw something against the wall. And I think as much as we can open a discussion about mental health, that would be, I think, one of the more helpful things we can do as a community moving forward.
Perfect. Thank you. Yes. And again, another great point to drive home, I think, that you just shared is normalizing the conversation around mental health, and helping kind of embrace and advance that education and awareness. Wonderful. Thank you both so much for your time today and for sharing your insight and best practices and expertise. And thank all of you for joining us today for this conversation.